You think she's yellow? Let's talk. Hi, and welcome back to Pocketbook Pediatrics. I'm Dr. Rishalan Brown, and as usual, I'm always so happy to have you here with me today. Now, we've been talking about our newborns and what to expect after expecting, and we're just about to jump out of that newborn period and start talking about the 6-week visit and the 3-month visit. But before we go there, we have to stop a moment and ask ourselves, are we seeing yellow? Yeah, we've been throwing around a word in some of our episodes so far and previous episodes as well, and we haven't really talked about it, and we need to stop and talk about it, and that is jaundice, because it's really in this newborn period that we need to know a lot about newborn jaundice. So let's talk a little bit. Now, jaundice is not something that can only occur in the newborn period. It can occur in childhood and it can occur in adulthood for different reasons, usually associated with the liver. But right now, we're concerned about our teeny beanies and what newborn jaundice means and why we even need to be concerned about it. So first, what is jaundice? And we've said it before, jaundice is really a yellowing of the skin. And you can also see some yellowness in the white part of the eye, that's called the sclera. And you can also see it in the mucous membranes, that would be like the mouth that you can see it in. The palms and soles can also be affected by jaundice. Now, in darker children, you may not see the yellowness so much in their skin, but you can see it in their eyes, the palms, and in the mouth as well. So it's important to know the different areas that you can pick up jaundice. Now, the next question we need to ask then is, what would cause this yellowness of the skin? Now, jaundice is caused by a substance called bilirubin that all of us have in our blood. And this bilirubin is what makes our urine yellow and our stool brown. And when we have too much of this bilirubin in the blood, then we have the problem of jaundice. So what are the causes of jaundice? What would make bilirubin levels go up in your baby's blood? And there are different reasons that this can happen. So one of the most common types, and I should say jaundice is very common, it's not something that we don't expect in newborns. We see it quite often, and usually there might be some kind of mismatch between baby's blood type and mommy's blood type. So say mommy is O positive and baby is B or A, then this mismatch between mommy and baby can cause mommy, when she's pregnant with baby, to build up proteins or antibodies against the baby's blood type. And so they transfer to baby, and when baby is born, they have an increased rate in the breakdown of their blood cells because of these antibodies. This usually causes a mild to moderate type of jaundice, but it's not something that can't be easily managed. Another mismatch between mommy's blood type and baby's blood type is with the rhesus factor. So it's a part of the blood that we call the positive or negative. And this is particularly important for mummies who are rhesus negative. And this is important because when you don't have that rhesus factor, you're negative for it, then your body will build up antibodies or proteins against the rhesus factor if it's present. So if you have, say, O negative blood and your baby has B positive blood, then your body will begin to make antibodies against baby's blood type. Now, this usually causes greater problems in the second, third, fourth, any subsequent pregnancy, and can cause serious pregnancy issues, including pregnancy losses. So it's very important for you to know your blood type, especially if you're going to become pregnant mommy. All right. So problems with mismatch in the blood. Another way that you can have an increase in the bilirubin in the blood is if there's an increased breakdown from things like bruises or what we call a hematoma, or in Jamaica we call it a good old cocoa. And a cocoa or hematoma is really just a buildup of blood cells under the skin. And For babies, this usually happens in the scalp. And it might be because there was a difficult delivery and, nurses or doctors needed to help. So baby got some bruises on the skin, or maybe they had to use an instrument like a vacuum to help remove the baby. And that can cause some hematomas under the scalp. Now, the way that bruises and hematomas heal is that they break down. So the blood cells break down, the cocoa goes away, the bruises go away. But as that breaking down is occurring, it is building up the levels of bilirubin in the blood. So that can cause the baby to have jaundice. Another way is with an enzyme that helps to keep the blood cells round. So there are many different parts to what's happening with the blood. And another one of them is that there are different enzymes that make the blood cells round, help them to pass through the different roadways or the arteries and so on in the body. And if your baby does not have some particular enzymes that help with that, it can help the blood cell to break down quicker than it should. So your doctor can check for those special enzymes. You might hear G6PD, pyruvate kinase, things like that. But your doctor will let you know if that is a concern that they have, because it may mean that there are special instructions for types of medications baby can use or types of foods that baby can eat later on in life. So be sure that if you hear those words going around, you ask your questions and you can get all the answers. So another way that we have to think about baby having high bilirubin in the blood is if they're not getting enough to eat. So a lack of good hydration, a lack of good breastfeeding is going to cause baby's bilirubin levels to go up. And this is for two different reasons. One is that think about bilirubin like syrup. If you pour syrup into an empty cup, it's going to be very concentrated, very sweet, very thick. But if you pour syrup into a cup of water, it's going to be much less concentrated, much less sweet, easier to drink, and it's easier to manage. So it's the same thing with bilirubin. If your baby is not getting enough to eat and drink, the blood volume is not going to be enough. And so the level of bilirubin in the blood will be higher because there's not enough water around it to help and dilute it. And the other reason is that as baby feeds, that breast milk is going to help the gut and the liver particularly to learn to change that bilirubin into the form that it can go into the urine and the stool. So baby's liver is not as mature as ours, and particularly premature babies, theirs are even less mature. But as they eat and drink, their bodies learn to do this processing of the bilirubin. So the more they eat, the more they drink, the more urine they'll pass, the more stool they'll pass, the more their bodies will get used to the idea that, okay, this is how we process bilirubin and get it out of the body. So we want to make sure that baby is getting enough. Now, the question that you'll ask next then is, okay, baby has jaundice. How do I know when to be concerned? What should I do? Very good question. So if you think your baby has jaundice at all, then it's something to bring to the attention of your nurse or your doctor in charge, because the only way we'll know how bad the jaundice is by doing a blood test. We can't know from just looking at the skin or looking at the eyes and mouth what the level of the jaundice is. And the level of the jaundice is very important because it determines what we do about it next. So if baby has a mild level of jaundice in Jamaica here, and I'm sure in the Caribbean, we talk about sunning the baby. But we have since found that the sunning the baby does not do any good for the baby at all. It's not making much of a difference. What we really want to make sure is that baby's getting enough to drink. So if you're having difficulties with breastfeeding, remember, bottle feeding is okay. And of course, reach out to someone for help. We can get lactation specialists involved. Your pediatrician can get involved to help see how we can best help your milk supply to come in, because we want baby passing good urine and good stool. If your baby has a moderate level of jaundice, then there needs to be something more that's done for the baby. And baby will, at this point, need to be admitted to hospital because baby needs a special light. So though sunlight doesn't do anything for baby, there is a light called a phototherapy light that can really help break down the bilirubin in baby's blood and help it to be passed out in the urine and stool. So your baby will be admitted and placed in a special incubator on the special lights The lights may be blue, they may be white, they're different at different hospitals, but what we want to make sure is that as much of baby's skin is exposed to the light as possible. So we do keep them in those special incubators. You are allowed to feed baby and touch baby, but the exposure to the light is the most important thing. You'll find that doctors or nurses will help to cover baby's eyes and their genitals to keep them safe from that extra exposure to the light. And the last thing now is if baby's bilirubin level is high. Now, if baby's bilirubin level is very high, more has to be done than the use of the light. And it would involve the use of something called exchange transfusion. So think back to when we were talking about the syrup and the cup. This involves giving baby good, healthy blood cells to help dilute the amount of bilirubin in the blood. Now, it's a procedure that we need your consent for because we need your consent or your permission to give blood, and there are different things associated with giving blood products. But we also need your permission to do the procedure itself because it can involve giving baby a lot of blood and, changing the salts in the baby's body over the course of this procedure. So they need careful monitoring while it's being done, but we do think it's important to get that bilirubin level down. And why is that important? Why are we so concerned about high bilirubin levels? We're concerned because very high bilirubin levels can cause a baby to have developmental damage later down the line. If that bilirubin gets implanted or placed in some of the brain cells, it can cause some very serious damage, which we don't want for baby. So we want as much as possible to keep that bilirubin down to a safe or normal level. And so that's why it's important for us to do those repeat blood tests to make sure that those bilirubin levels are actually shifting and moving. Now, what do we expect over the course of this jaundice? How long is it supposed to last? And that's another good question. So with newborn jaundice, we really don't expect that it's going to last more than about 2 weeks. If it's lasting longer than that, your doctor has to begin to think about different things rather than just the liver not being mature or the problems with the breakdown of blood cells. We have to begin to think about problems that may be happening with the liver itself. And if your doctor comes to that point, we'll have those discussions at that time and about what needs to be done to make sure that the liver is healthy and functioning normally. So that's all for Pocket with Pediatrics today. As usual, I hope you really did learn something. You understand why jaundice is important to us and the things you have to look out for. And, maybe you can help your little one on the way, nephew, cousin, neighbor with their newborn as they come now for what to expect if their baby has a diagnosis of newborn jaundice. Thank you so much for watching, and I always look forward to seeing you the next time on Pocket with Pediatrics. God bless.